patient was not a first-time visitor. He'd been to the practice several times before. This was the X-ray which the dentist used to perform the extraction. It isn't a particularly good X-ray by any standards. I don't know whether that reproduction makes it look worse, but certainly when it was cast about for an opinion, it wasn't highly regarded. So there were two issues in this case. One was the dentist had poor technique. There was obviously nerve damage afterwards. There was a technique issue. The issue was that the patient didn't really consent to it and wasn't given the option of going to an oral surgeon either. He was under duress. He signed the form because I'm in pain. Here, get me to sign it. Away you go. Take it out. I need help. I need help. There was an oral surgeon in the vicinity. He was not even asked about or given the option about referral to an oral surgeon. So there was the issue about consent, there was the issue about technique, and the issue about not the option of referring to a specialist. In the end, we changed hands on that one for $28,000. Okay, staff error. Patient was seen in a practice, female patient, young female, had a scale exam. She inquired about tooth whitening and she purchased 2 syringes of whitening gel, or so she thought. An inexperienced DA unfortunately gave her etching gel. We're still fighting with this one because although the clinical treatment may be only a few $1,000s initially, and I mean a few $1,000s, little, small amount of money, we're up for psychological damage and all sorts of issues here. So it gets complicated. This could be rather messy. So don't feel that the dentist is not at fault here. The dentist is going to have this dealt with by his insurance because the staff are covered under his insurance policy and everything that happens in the practice is his responsibility or her responsibility. Those things happen. It shouldn't have happened. There should have been some guidance given to the staff member, or at least it should have been sensibly checked, particularly when they knew the DA involved was basically in her first week of work. This is one of my favourite ones, and this was big dollars. A young female dentist who would be hard pushed to see over the top of this desk I'm standing behind, and probably weighed about 35 kilos, I'd reckon, made a comment in her records that there was an impacted wisdom tooth here, and because she was relatively new out of university, she felt it should be extracted by an oral surgeon. And that's the note she made in her records. Extraction by oral surgeon required. However, some months later, the patient came back to the practice and the dentist felt she could do a good job. That's the result. And there was total panic here. She phoned me asking what to do. I contacted our team oral surgeon and he said, get her to the hospital straight away, I'll fix her up. And he did so. But it got worse as time went on because the patient actually lived close by the dentist and walked past her surgery on a regular basis. But there was never any communication with the patient about, how's it going, terribly sorry this happened to you, are you being looked after, etc., can I do anything to help you? Wipe the patient clean. Too embarrassed to deal with the issue. As a result, went through an insurance claim, we went through a mandatory settlement conference, and I can tell you a lot of money changed hands over that. There's a good ad for using a rubber dam. It happens. Don't ask me what it is or how it got in there, but it shouldn't have. A burn. This is any burn which occurs on a female, I can assure you, is much more expensive than that which happens on a male. And that one there was deemed to be 5 to 10% permanence by a plastic surgeon. And several $1,000s had to change hands there, I'm afraid. But it was an accident. Those things happen. It was a mistake by the dentist, if you like. He didn't realise it was happening. And when he realised it, he was mortified, but the damage had already occurred. The patient didn't feel it because she was all numbed up. So there you go. There's another one. I understand this one was simply hot instruments. But we've had 2 cases recently, and I don't have any photographs to show you, of incidents where dental assistants have incorrectly assembled handpieces and they've drastically overheated very rapidly, causing significant burns to a patient. On the first occasion, the operator, the dentist, was smart enough to pick it up quickly. On the second occasion, he was too busy and didn't notice it, and there was a substantial burn. It's probably the biggest insurance claim I've dealt with so far. If you like seeing your name in the paper, this is pretty good. This happened in New South Wales, but there was another facial burn. It's pretty ugly. The dentist was named. It was an overheating drill. I've got two other examples here to show you. This is an implant case, and this is a general dentist who is basically not skilled enough to do the case, I'd suggest. But more importantly, there were underlying perio and endo issues that weren't addressed, and that certainly came out in the clinical opinion. When we get an expert opinion, this doesn't work because there were perio issues that weren't dealt with. The x-rays were poor. There wasn't sufficient bone structure to graft on. The dentist had been to one of those Butte weekend courses where he learned how to do bone grafts and did it, and it failed. And I can assure you he was very upset by what's happened. Not only did it result in a complaint to the HQCC, which was then pursued by the Dental Board or APRA, and it's now he's being taken to task over his clinical standards and his performance. And his last comment to me was, "Do they want my blood?" That's how he is emotionally feeling it. And the answer is probably yes. You extended yourself. They're going to make you pay. So there were lots of issues relating to clinical knowledge, experience and skill. And as I said, he attended a course. The implants failed. It was indefensible, basically. There are some of the records, which are very poor. Pretty scratchy stuff, hard to read. It took me ages to try and decipher what they were. They were some x-rays. Those implants in that case were actually put in the wrong place, according to the specialist perio who reviewed them. So, underlying perio was not treated, insufficient bone to support insertion, all three implants missed the supporting bone, hopeless prognosis were the words of the specialist. Insurance claim and disciplinary action is likely. That one is still going. Another one, implants with crowns, RCT and crowns, etc. Inadequate upper bone, so grafted from the mandible. Graft failed, infection, pain, implant failure. That was the starting point. Not a good look, I'd suggest. Work in progress. The issue with this one is we're dealing here with a guy who was a mine manager. And he was away overseas when it all flared up and pus was starting to come out of all sorts of places where it shouldn't, and he couldn't get back reasonably quickly, so it took a couple of weeks. But when he got back, he was not dealt with appropriately, is probably the best way I can suggest. And of course it became ugly and he wanted to make a complaint and a claim about it. Fair enough. Had it been dealt with correctly in the first place, perhaps it might not have gone that way. Had he been referred to a specialist to get the treatment in the first place, it probably may not even have been done in the same fashion, but it probably would have been a better result. He went beyond his limits, is what I'm trying to say to you. Be very careful about going beyond your limits. The result, consent failure, didn't ask about bone grafting, failure to adequately inform of all the risks, no option for referral to a specialist was given, lack of experience, blah, 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 etc., etc. Another one. Started off as a HQCC complaint. We settled that one in conciliation. I think, as I recall, the dentist refunded something like $13,000 and there was another at least probably $12,000, $25,000 package to try and compensate for that one. So there you go. And it's still subject to disciplinary action. However, on a final note, this is an orthodontic case. This young child presented. Mum was unhappy with the result. So, Mum went everywhere. She went to the ADAQ, she went to the HQCC, she went to the Dental Board, she went to two other specialists, she went to the newspaper, and she went to her local politician. All of whom said, "We don't think there's much wrong with this." But she had a view that because one tooth was a millimetre or so shorter than the other, this was going to affect her babe's acting career, and therefore the dentist should pay. Everybody who reviewed it said, "No case to answer, go away." And that's where we left it. Okay. The result, consent failure, didn't ask about bone grafting, failure to adequately inform of all the risks, no option for referral to a specialist to get the treatment in the first place. Had it been dealt with correctly in the first place, it might not have gone that way. And that's where we left it. If I could leave you with a couple of other messages, please stay within your limits. Make sure you're getting appropriate consent all the way through and they understand what's going on. Maintain accurate records. You've had enough reasons there, and a good example was Brad's own case there. Seek assistance and refer when required. Seek assistance from the ADAQ or whoever, a team specialist or someone, if you get out of your depth and something goes wrong. If you have an incident which you think is going to be ugly and will come up in the future, you need to notify ADAQ about it. Okay? So your obligations are to notify us, comply with, if you get something you must comply within the time frame. You must provide the records that you're asked to do so within a reasonable time frame. Generally we would say 30 days. I know Brad was being suitably lawyer vague about it, but you do have to provide, and the expectation is within 30 days they would be handed over. A copy would be handed over. And if you have a problem, ADAQ is there to assist you. Thank you.